This is the million-dollar question and the most common question that I have in my practice as an oculoplastic surgeon. Some people think they have dark circles underneath their eyes because they see darkness underneath the eye itself. Some people complain that they have puffy eyes because they notice this dark circle underneath their eyes and they describe that as puffiness. So what's the difference between the two? Puffy lower eyes is when you actually have prolapse, which is the pushing out of a little bit of fat in the lower eyelids. So we're all born with 3 fat pads in our lower eyelids. There's a medial, a central, and a lateral fat pad. And when we're young, they're back. You can't see them, and we barely can see the difference between the eyelid and the cheek and where that differentiates and distinguishes itself. As we get older and as we age, unfortunately, everything starts to sag a little bit, including the area around the eye. So as we have descent of the midface, the midface actually does fall slightly. You can see the actual location of where the lower eyelid and the cheek hit one another. This is often called the tear trough. If you have too much volume depletion in that area, you can get what is a very exaggerated or dark circle that appears around the eyes. And that is actually from volume loss. It is a shadow that's created by a dip in that area. So you would have normal eyelid skin, then a dip, and then your cheek. And it's that shadowing that creates the illusion of a dark circle underneath the eyes. In these individuals, using a little bit of dermal filler as replacement of volume loss can help soften that appearance of the dark circles underneath the eyes. Then there's the other person who actually does have prolapse of the fat above this tear trough, and that is outpouching of that fat. If it's a very small amount of fat, that too can be camouflaged and masked with a little bit of hyaluronic acid just beneath it within the tear trough to create a more even and uniform lower eyelid. In people who have the other version, which is more dark circles and volume loss, having hyaluronic acid is a wonderful temporary treatment to help create a more youthful, refreshed appearance. So with all dermal fillers, there are risks associated with injections, the most of which are quite minimal, like bruising and swelling. Those can be temporary. Other common but not as serious can be over or undercorrection, pigmentary changes from bruising, and in the more serious, less frequently found complications include tissue necrosis and blindness. So as I said, always important to have the best expert and best injector treating any area of your face, but particularly the eyes where the skin is less forgiving. Unfortunately, there is a subset of people who do not work well with either dermal fillers or surgery, and those are usually ethnicities like Southeast Asian ethnicities where the pigmentation on that skin genetically is predisposed to having a little bit more pigment. And unfortunately in those individuals, it is not the shadowing, it is not the outpouching of fat, it's actually the color of the skin in the area of the eye. And oftentimes those patients come in complaining of not only lower eyelid dark circles, but upper eyelid dark circles. And that is a much harder dark circle eyelid problem to treat. Other things that can cause dark circles that you can take control over. So sometimes in people who are smokers or who have allergies, dilated and tortuous vessels look like dark circles underneath the eyes. And in fact, we often hear the word allergic shiners, and it looks like you have shiners because you suffer from significant hay fever or allergies. In these patients, I always recommend taking an antihistamine every day for a month, seeing how things go, whether their symptoms are improving, whether their hay fever is improving. Sometimes they may need something a little bit more aggressive. So it really does depend. As you can see, there are a lot of different reasons for dark circles underneath the eyes.